Hello, everybody. This is Dr. Gordon Jones. Catch you up on what's going on here. The other day, I was given a talk on blockchain and the universal health coin, so I was able to talk about that as a use case. And I kicked this off because Adam Tabry's just posted this on his one of his LinkedIn posts, and I loved it. Socialized medicine and corporate medicine both have one thing in common. They both use the word healthcare to sustain a flow of funds towards a purpose other than caring for patients. And that's exactly what we're trying to counter with the universal health coin. And we'll jump into that because blockchain is what makes it happen. So universal health coin, UHX, is our token. And you've heard me talk about it before. So we're going to talk today about how we decentralize healthcare, which is get rid of corporate medicine and socialized medicine. Did you know that we spend $10 trillion in US dollars, $10 trillion on healthcare worldwide? Probably not, but we do. And that's through all the government programs, insurance, and also non-governmental programs through the UN. But here in the United States, we do a significant portion of that based upon our population. We're at 4.3 trillion of that 10 is spent here just in the United States. And it's crazy. This is a reason why. This illustrates the healthcare system in the United States, but it really illustrates every healthcare system because we could replace the private insurance companies with just another government program. Everything's driven by taxes and or premiums, and they are all put into what we call risk pools. And what that is, at the end of the day, is the ability to pool the money so that it can be centrally controlled by the government or the BUCAs. And now we in the health insurance industry call Blue Cross, United, Cigna, Aetna, and Humana the BUCAs, who represent really all health insurance entities around the world, not just those companies. But they are the biggest in the world, and so we use that name because it's a pretty cool name, BUCAs, to represent them. But that's who we want to get out of control of our healthcare. So let's just give you an example. Let's start off with Joe. Joe wants to see a doctor. We might provide the doctor a little copay, $60 or something like that out of the visit. But what has to happen from the doctor's office in order for them to get paid by the BUCAs or the government is first the doctor has to code the procedure. They usually do that through an electronic medical record. A lot of people think electronic medical records are for clinical purposes. They're not. Electronic medical records in the United States specifically were created so that you could properly code the procedure, which then fills the bill, which then turns into a claim that is submitted to a clearinghouse. Now, the clearinghouses take in all the claims from all the different doctors' offices, hospitals, pharmacies, labs, and then they're connected to all the insurance companies, which are about 1,200 different entities here in the U.S., including those third-party administrators that take care of the government plans, switching out the claims from the doctors and the health systems to the various third-party administrators. And what they do with it is they adjudicate the claim, or in other terms, they scrub the claim. And that's why we have a brush on that claim. Then once it's scrubbed and adjudicated and said, okay, this claim is legitimate for the coverage of this care, then it gets sent to the preferred provider organization, which is a network of physicians under contract, PPO. What happens there is that claim gets repriced based upon what that provider is supposed to get paid according to the PPO contract. Then that gets sent back, it gets cleared again by the TPA, and then it gets sent to the payer. And either the government is the payer or the BUCA is the payer, and usually on behalf of an employer. And then they send the money to the doctor's office. The problem with this is a legacy business model that is 80 plus years old and gets in the middle of healthcare provider and their patient relationship. And this is what we want to get rid of. We want to get the middleman out of the relationship between the provider and the patient. So how are we going to do that? Well, first of all, one of the biggest problems on the provider side of having this third-party administrator in the middle is that the claims, the payment by 30 to 120 days, even through government direct systems. So now, because of blockchain, the emergence of blockchain and cryptocurrency technology, because as I've said before, we can't have cryptocurrency if we don't have blockchain. We now have the ability to completely reinvent healthcare, finance, and payment. So let's get back to Joe. Joe has provided funds into what we call his wallet, or in normal terms, is just your account. So you pay into your account your funds, and then let's say you want to go to the doctor. You're going to search for that doctor, and in the smart contract, they're going to be transparent with their pricing for the procedure. So you'll be able to see the price that you're going to pay for whatever procedure you're going to go to that doctor for. And they also have an account or wallet within the UHX system. What happens then, the transaction, you remember that transaction from the doctor's office going through the clearinghouse, the third-party administrator, the PPO, and then through the payer to finally get back to the doctor. Well, in this scenario, all it does is go through the Stellar protocol, which is a blockchain solution that we have built the UHX system on top of. And then that gets sent right into the doctor's wallet. And then the doctor can draw those funds right out. And this is instantaneous. So once you go see your doctor, and then you and the doctor both say, yes, the service was provided, that executes the smart contract, which then releases the funds into the doctor's account. That's it. So we get rid of this whole third-party legacy system and all the middlemen that are touching the dollar and keeping a good portion of that dollar from actually providing patient care. Or Joe goes to the doctor provides the service, Joe pays the doctor gets paid. That's it. So our vision and strategy here at Universal Health Coin is to revolutionize healthcare delivery and financing around the world, giving autonomy and choice to patients, and enabling collaboration between healthcare providers. Patients, providers, and payers will benefit from increase of quality of care and efficiency, which then drives reduced cost for all stakeholders, even the payers, which in this case we like to say is the government. So they'll pay into the system, or the employer will pay into the system, but they won't be controlling the system. The community is controlling the system. So our strategy is to use blockchain tech to decentralize the marketplace. And we have a short-term roadmap, a medium-term roadmap, and a long-term roadmap. So our short-term roadmap is to transform the payment and reduce the cost of care by cutting out the middleman. That's exactly what I just illustrated. The medium term is to actually help revolutionize the patient-directed collaboration between providers and patients through the blockchain managed health exchange. So giving patients or members a lot of freedom on choosing the doctor or health system they want to go to based upon the transparency of the fee schedule that the doctor is providing through the smart contract system. And then in the long term, enabling collaboration and patient control of data, of their data, by ingesting and sharing healthcare data from a wide array of sources, which would include that electronic medical record I was talking about, labs results, pharmaceuticals that they're getting at the pharmacy, some insurance data. If an insurance company comes into the ecosystem, then they can share their insurance data controlled by that individual. And at the end of the day, we need your support because this is a community-based project. We want to build the Universal Health Coin and Universal Health Share as a community, and we need your help and support to do that. Again, this is a worldwide problem, and we want people around the world to participate. So what do? All you have to do is go to uhx.io and learn more, and there you will also be able to register to participate. So thanks for listening, and we'll talk to you later.